Okay. Great. So, yep, it's recording. Terrific. So, I'm grateful for your attention, that first foray to modeling. You know, I know many of you have exposure from your pre-surveys. I know many of you do have previous exposure to aspects of dynamic modeling. But because the perspective of different dynamic modelers can be so disparate, I really thought, you know, providing a certain perspective, articulating it clearly early on, is very important. Not least because so much of this boot camp is focused on this nexus of data and models. The role that those models are playing, how they, not only the questions we answer with them, but how they fit into the broader the context of a research program in a certain area is going to be very important. And I wanted to have some sense about sort of my prejudices and viewpoints on models, so you know where I'm coming from. The modeling process is one which I've detailed in some of my lectures elsewhere and for some boot camps in more detail. And because time is limited, Jeff talks with me for my boot camps. He says the biggest challenge is what's the 90% you're going to leave out? And there's a lot of truth. There's a lot of truth to that. In this case, I'm not going to have a chance to go into the modeling process in detail. You'll find me opining on it online in various fora and with comments in different aspects. I did want to highlight the emphasis I articulated earlier to Kim, that the modeling process is one that is far more effective if it's conducted incrementally because of the learning that you secure through interaction with the model. It is humbling, ladies and gentlemen, for someone who's worked for so many decades with the model to see just how much I learned from even an extremely simple model. You know, I've been working with these things day in and day out in all different guises, and I still find myself learning from small models, getting started in a certain area, and I just make better decisions after having worked with them as to what comes next than if I plan it all out up front. And you know, getting something down and looking at it, working with it, often provides a lot of additional insight. I should also note that I emphasize again that models are used for many purposes, and some of the purposes are as much sociologic as they are scientific or pragmatic in terms of decision making. And there are times where a model is being used to bring groups together that are often working at cross purposes or see themselves as competing for sources of funding. I remember 20 years ago when I was doing my first modeling consulting, we had a client for a company that was working in the higher education space in the States, and they were constantly at loggerheads, the higher education system and the high school system, secondary schools. They were constantly at loggerheads because they were competing for similar pools of funding in the state. And you know, they would each have lobbyists in the legislature, the provincial assembly, to sort of argue for why they should be getting this funding rather than the high schools or vice versa. So universities and high schools, and it was a somewhat contentious relationship. And when we did the modeling for this university system, it was a public university system at a time of considerable belt tightening. What they discovered is that a lot of their problems, once they looked at it with a quantitative lens, a lot of their problems would best be alleviated if there were better funding on the high school side, because they were inheriting a lot of problems from high school students coming into universities that they then have to remediate. through classes and efforts and because of dropouts by students, etc. If only they were the powers that be would invest in the high schools, the universities could avoid a lot of costs and a lot of challenges to their operation, a lot of capacity planning issues or what have you. And so they ended up going to the provincial assembly. I can't remember what it's called in Texas. I should know, but provincial House of Representatives or something, and basically arguing for why there should be increased funding at the secondary school level, and why that needs to be joined with funding at the university level. And so they actually joined forces and went to secure greater funding for education as a whole. And that's just one of many examples out there in the literature and in experience of modelers for how modelers can bring people together. We're not going to have time to focus on that this week, but just be aware that models come with different purposes. And one of the reflections here is also the modeling process itself that offers value. We're used to thinking about the model that comes out of the modeling process as the real deliverable, the determinant of value. It's the artifact that we can look to and say that's the asset. But often the bigger asset, ladies and gentlemen, is up here. It's in our heads. It's our degree of sharpness in thinking about the system. It's our degree of understanding about how the pieces of the system fit together. And it's our recognition after a systematic look on what parts are question marks and what parts are reasonably well known, what we know and what we don't know, what we need to know still, the priorities. So even if the model were in a fit of, data failures were to disappear, often there's something gained by that modeling process. Bringing people together, yes. Sharpening questions, sharpening understanding, sharpening sense of priorities. And that's not to be underplayed, even though so much of our efforts this boot camp are on the quantitative results. I thought I'd be remiss not to mention that. So if we think about the modeling process, ladies and gentlemen, we think about a highly iterative process, which is best undertaken incrementally to allow for the learning. And it starts very early with the topic we're going to be spending considerable time with right now. Problem conceptualization, and to some degree this qualitative problem mapping. We think about these models as highly quantitative artifacts, and they are. They often will involve that in a big way. But they often originate in understanding that starts in its first glimpses of being somewhat qualitative or sketched out in a sort of rough way. Remember that these models are not merely repositories of data in the form of numbers, but they capture knowledge of other sorts. What relates to what in the system? How these processes relate to one another? What are the stages of infection? To what degree, asymptomatic cases stay asymptomatic? To what degree do they instead eventually develop symptomatic features? The understanding of the pathways, understanding if there are linkages to another, what parts of certain workflows relate to what other parts, what are the staging of steps by which a patient who arrives at a facility is worked up, etc. These are all basic things, and they have some data components, but they also have just some components of understanding how this kind of the flows of the system, which go beyond just the data. It's knowledge in another form. And often those things are mapped out early on in the form of state charts and stocks and flows and kind of mapping out workflows with elements from discrete event modeling. And we create causal loop diagrams, etc. And we'll see some of those. A later stage goes on to model formulation, where we're specifying equations that we're sort of positing as linking up components, or specifying algorithms by which things are determined. It goes on to a model calibration phase, often, where we're trying to match the emergent features of the model against observed data, very important. And quite a bit of data gets incorporated between these two factors, the model formulation and calibration. And then there's model testing, which again often occurs against data. And sometimes in a technique known as cross-validation, some of the data is put aside in these phases and only compared against the model here. So you're building the model with respect to a subset of all data. Maybe it's with respect to 75% or 80% or what have you. And you see if the model matches in its anticipation and its expectations against model testing. A frequent form that this takes, which has some statistical implications for it, which could be discussed, is sometimes you build the model with respect to data up to a certain year, maybe 5 years back, and then you judge it, especially against the last 5 years of data. So you actually have those last 5 years of data, but those aren't used to calibrate the model. They're not used to build into the model, but they're used to judge the model. So often that's done. And the last 5 years are not statistically independent to the earlier years. So it's not taking an entirely independent set of variables, but it often will give you a sense, is the model capturing kind of the current baseline situation before you're using it to look at big counterfactuals. You then look at the policy evaluation space or other aspects of knowledge translation to translate it into actionable sort of decision making or prioritization, et cetera. So there's a broad set of phases that we go through, and often we iterate through them as we make discoveries. Model calibration is a great learning opportunity. We find the model just doesn't jive. Model calibration, sometimes people think, by adjusting the parameters, you can match any data. Far from true. Many of my biggest experiences in learning from a model have been where it just cannot match this data. And I got to go back and figure out what's wrong. And most of the time, I end up refining the model. I end up adjusting a certain assumption, and that makes sense of it all. In other cases, about 4 or 5 cases in my career, I found other major problems. But the problems, ladies and gentlemen, have not been with the model, but with the data. And sometimes there are things they didn't realize. Sometimes there are things that you have to go back to the data source and they say, oh yeah, 2009 we redefined what it meant to be in preschool. Or kindergarten included the last year of preschool or something like that. We lumped that together. Or during those years, the notion of TB was broadened to include incipient TB, and so for those years you can basically ignore it. It's inconsistent with the rest. And I never would have known that. I would have been using this data flying blind if I hadn't had a model that said this just doesn't add up. It doesn't make sense. I only found these inconsistencies with the data, or thought to drill down and really push it and find it, because the model was telling me this data doesn't make sense with my theory. And it turns out it wasn't my theory that was off, it was the data. Data doesn't come from heaven. Unless it's more like a sausage factory. And not always, believe me. I'm a primary data collector, so I know my students are not making sausages. But the truth is data comes from humans. Data comes from humans, and they're humans sometimes under pressure, or there's humans who sometimes change their processes and forget to communicate it quite as fully, or what have you. The metadata doesn't follow the data appropriately. So a key deliverable here is often the mental model. And you think about the modeling process, that learning about data sources, what's reliable, what type of subsets of the data were reliable, when those redefinitions occurred, that's a real asset. And you built it up during modeling. So incremental development, I have lots of slides about this and how it can be conducted well. I don't have time to go into here, but suffice it to say, you build successive versions, you try running each version, you observed its new dynamics, you say, oh, adding that one feature caused these new dynamics. I didn't see those oscillations until I added this. Or, previously it hadn't matched this type of empirical data, now it does. So maybe that has given me some insight to what might be causing this certain trend or what have you. Incremental model development helps you spot model problems sooner because you're adding just a little bit at a time. If there's a problem that comes up, you know where the change was that led to it. It lets you learn from what is causing what behaviors in that model. And it lets you also, from that learning, shape what comes next. Okay. It's also really good practice for spotting problems to take a model which has a new change in it, to disable that new feature for a moment and make sure it still reproduces what you saw earlier, and then turn that new feature on and see the implications of it. So here, each iteration model is modified, and you've got something in hand on an ongoing basis that you can show people. And often you're showing to certain stakeholders, or using it to shape the next step. So I have a bunch of benefits here. There's some nice frameworks for thinking through what's in a model. I prefer the parties framework, which is a variant of Ross Hammond, an esteemed colleague from Brookings Institution in DC, Party framework, P-A-R-T-A. The framework I use is a slight variant of that, which adds some more specificity. So here, agents within the model are associated with properties, which are more static characteristics. They're associated in any logic with parameters. So if you go to the AnyLogic palette, if you still have your AnyLogics up, don't bother calling them up. If you don't, but you'll notice these things here, these are parameters. So this person has a parameter associated with their preference for convenience store meals, and they have a parameter associated with where their home is. The place, ladies and gentlemen, where they hang their hat. So these are properties of a person. There's also actions. These are actions which basically lead to change in their state over time. So we say that there's a state of the person and then an action which changes that state. Okay, so an action here would be, for example, if we go back to our AnyLogic model, we might think of actions as occurring here as changing the state of their weight. Or we think of an action here as being a transition between states like shopping, convenience store, and going home. Or between not seeking food and heading to one of these food sources, engaging in food procuring behavior. Those are actions. It changes the state, okay? And then there's rules that affect when they change their state, okay? Under what conditions? So, for example, there'll be rules under which this person is triggered into seeking food, and those rules end up being associated when they have exhausted their larder. So they have an eat meal event 3 times a day, and if they go through their larder and they're out of the food, they would consume, oh my gosh, that's misstated. No one's ever pointed that out before. Okay. Maybe it just appears that way. It says eat a convenience store, but which is a little bit fibrous for most people's preferences. This should be eat a convenience store meal. It just wasn't. It just wasn't visible. Sorry. So there we go. Okay. Eat a convenience store meal. Okay. They will, if they had a preference and the food's in the larder, they will do so. Otherwise, if they're out of food, they'll go shopping and go shopping for food. Okay. So it's under that condition that's associated with the rule by which they will engage in food seeking behavior. There's a different rule associated with their caloric expenditure based on distance from parks. So there's rules under which actions are taken or that govern the sort of extent of those actions. There's also time that's implicit in this. What's the time horizon of the model? What are the time units associated with it? Any logic adheres to a continuous notion of time. We measure time in continuous units, not in discrete time steps. But other agent-based modeling packages hew to a discrete time step preference. So time goes in one-day chunks called time steps, or called ticks, very common. Not as in the invertebrate, but as in the sense of ticks of a clock. So here, ladies and gentlemen, time is an aspect of model formulation. Interventions, which interventions must be considered? Ladies and gentlemen, if there's one thing that comes to the forefront in terms of shaping model scope, it's the interventions that need to be considered, that need to be evaluated for the model. They end up often shaping what processes need to be in there, what causal pathways have to be represented to capture the effects of these interventions. The environment, often agents are placed within a context. This environment might be spatial, we saw that with the GIS components, but it also might be a network context, for example. They're placed in a network nearby certain people, they're in a familial network or a collegial network or a sexual network or intravenous drug use network. And so we represent that with topological connectivity rather than spatial purely. You can have both, in fact. You could have people in a social support network who are also in a GIS environment. But this is part of the environment. And one of the big distinguishing features of agent-based modeling compared to discrete event modeling, both are articulated at individual level, but here you have agents interacting with their environment. So maybe you have the agents being deer, and they are shedding prions, these misfolded proteins, into the environment around them. Or maybe it's individuals going to work at a long-term care facility and being carriers of MRSA, methicillin-resistant Staphylococcus aureus, and Staphylococcus aureus, and they end up shedding that on surfaces. Maybe they pick it up from surfaces sometimes, or pick up Clostridium difficile. We can have interactions with an environment that may be affecting their behavior as well, built environment, right? I'm less likely to engage in an active physical transport if there's not supports in the form of bike lanes or bike paths or in the form of walkable sidewalks, etc. So here the environment might shape agents and agents might shape the environment, shedding into the environment, shaping its resource availability, etc. And as I noted, there's states. States are different than properties. Properties are kind of for more or less persistent features of an agent, their ethnicity, their sex, perhaps their place of birth or their birth weight. These are features that don't really evolve over time, where states are their characteristics that evolve over time. And I like the distinction. Ladies and gentlemen, parties, why am I articulating this? Because when I start to think about a model, it's useful to think, what are these basic features? And sometimes we write them down as associated with this model to describe it in a structured fashion. Sometimes people might even publish with this sort of characterization, systematically going through and enumerating these features of a model. And Ross teaches with party to good effect as well. There's a framework called the ODD and ODD Plus, even better, protocol for documenting ABMs that some of you may be interested in. And I've published papers, and others have published quite a few papers that use this methodology to document ABMs when publishing them, sharing them with the literature. But I want to focus now on this early phase, problem conceptualization, in the scoping of a model, setting its boundaries. What does it include endogenously? What, ladies and gentlemen, exogenously, and what ignored? What things does it produce? What things does it tell us, in other words? What things do we tell it, exogenous, and what things are we leaving out deliberately? we went over some principles associated with this. And I'm going to just note that for agent-based models, we have to be particularly key about this issue. With system dynamics modeling, traditional aggregate system dynamics models, one is limited by the medium, the sort of mechanisms by which you built them. They naturally become awkward once they reach too big a size, once they reach too big a scope. And so with system dynamics models, there's often a certain set of forces pushing back to limit the size of the model. There's only so many things you can express conveniently in an appropriate fashion. And so you tend to see the models there staying a bit more limited by their own sort of natural tensions. But with agent-based modeling, ladies and gentlemen, we have the ability to articulate a remarkably rich set of features. When we have a model like this, agent-based or hybrid, we can articulate very detailed rules, for example, involving food seeking and food consumption. We can involve more detailed aspects of the environment. We could characterize inter-individual transmission of norms and attitudes. In short, we have the flexibility with agent-based models to elaborate the model in a free-flowing way that has limited constraints on it. The constraints mostly have to do with a couple of things. Key things: time, which often is not early, how long it's clear it's going to take to do things. One of the reasons for incremental model development. You pace yourself, you get something along the way, rather than putting all your efforts into a big thing way down the road, which it's hard to estimate how long it's going to take. You get something at each step, and that may clue you in you want to stop earlier. So that time is one of the big constraints. Another constraint for agent-based models is availability of human resources to build them. Geeks like me. It takes expertise to do detailed model formulation. It's not just a matter of programming. You just don't throw a regular programmer on and say, go build this model. A programmer, your average programmer is going to have, okay, let me put it very baldly. Your average programmers have no clue about how to build a model from scratch. It's not to say that they build it poorly in its details. If told what to build, they actually might be able to do a very good job. The problem is they won't know what needs to be in it and what left out. And they won't have the understanding of the health understanding to be able to parse some of the directions that are given. So you need someone who's interested in characterizing things in the world and has a motive ability to express how one does that in a model. And that's not just your average programmer. It's someone who learns how to build models that characterize processes in the world. And yes, programming is part of it for agent-based models, but that's just a piece of it. They need to be able to not only build the model right, that's the programming side, but to build the right model. And building the right model, what model to build, that's often the trickier question. And you can have people who are quite talented, actually, about building the model right, but they end up going awry because they're not building the right model. They're building a model which is not suitable for the needs that are at hand. There's a mismatch. The third limitation to these sort of the scope of these models is often knowledge, or if I may, with deference to Kim, data as part of that knowledge. There is a risk that we'll build models that are speculative, too much so. And we'll sort of spin our wheels and say, well, it'll be this way, that way. And we'll get a little bit of insight, but it's not advancing our research questions. And so there is some element of that. But the point is, we have enough flexibility to hang ourselves by our own petard. You know, we could accidentally we can excellently create a model that is big beyond what can be sustained, and speculative beyond what we're comfortable with to address the types of questions that we're interested in. So you have to be very careful with these sort of models. It's very easy to add in deep levels of details. And one of the biggest rookie mistakes that can be applied with agent-based models is opening the floodgates and putting all sorts of things into them because that's the way the world is. We need that. Oh, we're missing that. We're missing this feature of the world. We're missing that feature of the world. And Shakespeare said it first, ladies and gentlemen, in King Lear. That way lies madness. Maybe I exaggerate a little bit, not madness, but frustration, certainly. It's good. It doesn't lie definite madness or like the United States, this event will be led by a madman. I've had my brush with making that mistake, and I've survived it with my sanity, I think. But you folks will be the ultimate judge by the end of the week. Okay, general principles here, ladies and gentlemen. Generally speaking, there's a high opportunity cost to investigating and investing in a certain given model area. So given limited time, we have limited time on our projects. We have limited effort we can expend. We have to expend it in a judicious fashion. We have to put our efforts into representing this in more detail or that detail. John Sturman talks about a logical knife. We use the purpose of model to cut away unnecessary complexity. So we focus our efforts in the areas where it matters the most. And there's a principle in software development, the Agony principle. You ain't gonna need it, that we like to start with for modeling in my group. And that means you don't put it in until you're quite convinced you need it, and you're working at piece by piece, building it up. So you start simple and you add as one develops confidence and understanding about the model. Okay, now I need to emphasize this point because this is often with health audiences, it's a point of a potential disconnection. And forgive me, all of you, if I'm telling you things that for some of you are obvious, because they are not, I can assure you, to some people in the room. A key step that we need to think through with models is, and I try to phrase things in health science terms. One of the terms you'll hear a lot in health sciences and certain subliteratures is causal pathways. The kind of understanding of the mechanisms that are governing certain features. We may be interested in certain observables and explaining patterns in the observables, but to capture these observables, to capture the dynamics observed for these observables, to be able to understand how those observables, things we care about, will be affected by interventions, it is typical that we will need to articulate for the model to posit some sort of causal pathways that govern those observables, okay? That govern the outcomes of the model and that link them up to the interventions we're contemplating. So we're interested in asking certain what-if scenarios. We need some way of taking those scenarios and saying, how are they going to affect the things we care about? Maybe it's cost effectiveness. Maybe it's incremental cost over incremental qualities. Maybe it's some measure of effectiveness. Maybe it's gain in terms of reduced mortality. We need some causal pathways that link up one thing, one of the interventions, the things the interventions affect, to the downstream features we're interested in. And often these pathways end up including factors that are not directly observable. And by and large, the stakeholders will not request such things explicitly, but they are implied by the need to investigate interventions. Okay, so I had some little examples here, which I elaborated a little bit yesterday. So, if we want to identify trade-offs between, for example, housing voucher intervention designs in terms of to whom we'll give a housing voucher, and the extent of the program. And we want to understand the impacts in terms of certain outcomes, maybe obesity, crime involvement, and graduation rates, all of which have been described in the literature as sort of being affected. We might think about pathways that start with recreational space availability, perceived safety, and so on, and they end up affecting a number of latent factors. I actually have a much better version of this that I crafted, and I think it's down here. Yeah. So here, we might have a move to a mixed income neighborhood of individuals. I'm thinking particularly about programs like the Moving to Opportunity program that operates in the States. And that ends up affecting placing families in new neighborhoods, poorer families who were previously in a neighborhood that was perhaps suffered from limited recreational space, limited walkability, less perceived safety, lower quality schools. It is shocking if you understand how school funding works in the States. And we in Canada and you in Australia are so lucky to have a much more enlightened system than what operates there. But in the States, school quality is strongly affected from a poor neighborhood to a large one. There may be gaps of several times in the funding per student. And healthy food availability in some cities is affected by the lack of food stores offering fresh fruits and vegetables, an area which Winchell has worked on quite a bit. So a move to these neighborhoods may affect these things. And if we're interested in understanding obesity levels or pro-criminal involvement or graduation rates, we're going to be needing to think about how these things affect it. Let's focus on obesity. Different people in the literature, different researchers have talked about, for example, moving to mixed income neighborhood. They've posited that what might be going on might be predominantly an effect of greater access to recreational spaces, ball courts, and areas and green spaces where kids can exercise, and that impacts moderate and vigorous physical activity and ripples through to BMI and obesity levels. Other researchers have talked about, this move affecting perceived safety, and that leads to more moderate and vigorous physical activity. It may also lead to greater walkability and changes in sedentary behavior, both of which, sedentary behavior beyond simply moderate to vigorous physical activity, ripple through to BMI and obesity levels. Others have emphasized, the strength, for example, of networks, kids spending more time at home rather than out with the buddies in the neighborhood, and that increases the time spent at home, and that ends up, and there's a link here that should be present. I stand corrected. Here it is. Yes, right. Time spent at home ends up impacting healthiness of diet because they're eating more of mom's good cooking rather than McDonald's Big Mac or something. And that ripples through to BMI and obesity levels. So they've highlighted the dietary behaviors and environment as being more favorable in the newer environment because of more time spent at home and because of the availability of healthy foods. These are different hypotheses that involve different causal pathways. And if one's thinking about a simulation model that might capture these effects, you're going to be wanting to think about those pathways because a given intervention might be operating simultaneously through several of these pathways, right? And there may be differential effects that are in tension, say in sedentary behavior and moderate vigorous activity. For example, a child spending more time at home rather than out with the buddies in the neighborhood in high school might exhibit more sedentary behavior, but at the same time have access to a higher diet. And so if one's thinking about the impact of an intervention and its impact of a portfolio of interventions or movement to different types of neighborhoods, thinking about these causal pathways as they mediate obesity levels is important. What's going to be challenging is that some individuals think predominantly in terms of, in terms of the observables. So, gosh, this got kind of butchered. That's most awkward. Let me see if I can undistort it even before our eyes. Okay. Hey, come on. Let me see if I can stretch it and thereby make it less unpalatable. There we go. Okay, there's a limit to this. Okay. Here we go. Move to mixed income neighborhood impacts recreational space availability. These may be more observable things, impacts BMI and obesity levels. If one's only thinking about the observables, some of these factors in between and their interaction with each other will be submerged. These often harder to measure factors. And that can often be a real challenge in terms of characterizing what comes out, because those intermediate factors may be affected by several different aspects of the intervention or by several interventions at the same time. And often it's those factors along the way in the sort of causal network that we articulated, this sort of causal network that formed the key mediators for intervention outcomes, and which, more than that, even though they may not be easily observable, they serve as the nexus for understanding how different interventions affect things. And if one simply hard codes the impact of different moves to BMI, for example, one's missing the ability to articulate why certain interventions yields greater gains than others, and how portfolios of interventions might change things. So these factors along the way associated with the causal pathways are often key to understanding intervention effects and key for understanding patterns of outcomes that we see right now in different contexts, and generalizing a model from one context to other contexts as well. It's because we can take into account these intermediate steps. Just like, I don't know how many of you are familiar with Bayesian modeling, and sometimes with Bayesian models, the observation is made, Bayesian statistical models, that including latent factors can actually, in some cases, really make a model more robust, but also more simple to specify. You're including these latent factors that help simplify some of the relationships that need to be captured, reduce interaction effects, etc., by virtue of the fact that you have these latent components that are posited. And I would say it's like that with these models. Actually, sometimes take into account the causal pathways that are involved, even the latent factors on them, simplify your model formulation and lead to less hard coding of certain relationships. I'm going to come back to this in just a moment. So we need to consider the causal pathways. If I could consider an additional feature along these lines, it might be something like this was for an intervention in the Chinese context that we were involved with, and here, there were naturally a focus by some of the researchers involved in the more observable components, whereas some of the intermediate components that could be captured in a model were underplayed and sort of underrepresented. Similarly, if we're dealing with infection transmission, and we were approaching a kind of an exogenous, this should say, I don't know what I was doing there, exogenous view here. Here we go. I should say exogenous. This is real-time correction. Okay. So I'll update those slides. Here we go. A more exogenous view would sort of say, okay, someone's immune system strength. If we were interested in understanding how does varying immune system strength in a community end up affecting the burden of H1N1 influenza or seasonal influenza in that matter in that community. How does the fact that there's older people and long-term care facilities, for example, who might be subject to flu at any time during the year, how does that end up affecting the prevalence of flu for others in the population throughout the year. If we were interested in understanding that, we could try to hard code using statistical data the relationship between immune system strength and different factors of relevance to infection transmission, duration of latent period, duration of infection, risk of transmission to others, risk of complication, risk of death, as being an adverse endpoint. This would be a kind of hard coding how immune system strength affects each of those. But it becomes much easier at some point to articulate kind of a theory of the dynamics of the situation where we actually are representing how immune system strength affects viral dynamics involved. This is some work we did about 9 years ago or so, which has been published in various forms for different pathogens. But the point here is at some point capturing the viral dynamics is more favorable because that ends up allowing you to understand some of these same factors from an endogenous perspective. The viral dynamics naturally leads through understanding the viral dynamics implies things about the duration of latent period infection, risk of transmission, complications, and death as emergent properties. So instead of hard coding this as a direct relationship between these things emerge from a theory of the viral dynamics that's unifying. It's kind of a unifying underlying theory of the dynamics that ends up explaining all of these and ends up explaining them in a way that allows us to ask counterfactual questions about mixtures of individuals with differential immune system strength, or to adapt this model to perhaps from H1N1 to seasonal influenza more easily. So here, these factors that would otherwise have hard-coded relationships would instead be emergent features of this sort of system of the underlying causal pathways. So I'd like to talk about this issue of kind of endogeneity and exogeneity. So generally speaking, we're focused on understanding the causal pathways here, and we'll often draw out a version of the system from a high level. This version of the system may be a causal loop diagram. This is what we call a system map, which articulates the relationship between a bunch of different variables in our system. How many people have seen causal loop diagrams before? How many people feel they have a pretty good understanding of what this represents? Okay, so a causal loop diagram is a very convenient form, particularly for system dynamics, but parts of it carry over very nicely for other types of modeling as well. So if we have a given variable, so a causal loop diagram depicts a set of variables. Those are shown with names here. It also depicts connections, posited causal connections between variables. So if we have a link from variable A, say stress levels, to variable B, say likelihood of maladaptive behavior, that link will be associated with a polarity. You see that plus or minus? And what that's telling you, the presence of an arrow itself tells you if you affect the source, your stress levels, all other things being equal, it will yield a change in the variable at the downstream side of the arrow, in this case likelihood of maladaptive behavior. So if one changes stress levels, it'll tend to cause a change in likelihood of maladaptive behavior, all other things being equal, it will affect it. Now the polarity, the fact that it's a plus, means if we increase stress levels, all other things being equal, it'll tend to increase the likelihood of maladaptive behavior on the part of that child. If all other things equal and compared to the value it otherwise would have had. So it will increase it, not necessarily over time it will be increasing, but it will increase it relative to the value it would have had we not increased stress level. Okay? So it's telling us that there's not just an association between these, but adding to stress levels will tend to causally increase this likelihood of maladaptive behavior. And decreasing stress levels will tend to decrease that compared to the value that it otherwise would have had. A negative polarity would indicate the opposite. So for example, a child who's exhibiting maladaptive behavior here, as that increases, there's a negative polarity arrow going to social support. So as maladaptive behavior increases, it tends to lower the amount of social support available compared to what otherwise would have been the case, all other things being equal. And if maladaptive behavior went down, it would tend to increase social support. So in other words, if one moves is likely to maladaptive behavior in one direction, it tends to move social support in the other direction compared to the value it otherwise would have had. So from a diagram like this, from reason about the polarity for particular lengths, we can reason about polarity for whole paths by composing those polarities, by multiplying them. And that can lead to identification of polarities associated with feedbacks. So for example, we have a feedback here amongst social support, co-regulation, stress levels, and maladaptive behavior, where there's almost a vicious cycle in place. With higher levels of stress, more maladaptive behavior, less social support, less co-regulation, and higher stress levels, and the cycle continues. Okay, so that's an example of a feedback. Unfortunately, the directionality should be flipped here. Similarly, maladaptive behavior can increase stressors by causing distressing social situations, among other factors, which can increase stress levels further, and there's a negative feedback, positive feedback there. By contrast, self-regulation and co-regulation by a parent or others can help regulate stress levels associated with a negative feedback, meaning that an increase in stress levels will ripple around to lead to a change that pushes back against that increase. It'll ripple around to a change that tends to lessen the increase. Our lives are full of negative feedbacks as well as positive. Positive are often associated with very rapid change, sometimes with vicious cycles. By contrast, negative feedbacks, regulatory feedbacks, these are associated with systems staying in balance. Homeostatically, we see tons of these. I grow hungry, I eat my sandwich, I grow less hungry. Being very hungry triggered an action that lessened the original cause, lessened the hunger. Thirst, another factor. Hopefully learning, right? Our learning is, our understanding is off. It leads to more mistakes. We learn from those mistakes. Our understanding gets better. There's lots of regulatory feedbacks that we strive for at an individual level and institutional level. And causal loop diagrams provide a way of trying to communicate these things in a way that can be insightful. And it's amazing what sometimes bits of insight you can get from these. But they're mostly qualitative. It's only slightly quantitative in the form of, I wouldn't call it quantitative really, but they have slight components of that in the sense that you have polarity. So this is a type of diagram which is used a lot in this earlier form. Jeff and I have been working for several years to evolve diagrammatic techniques for agent-based modeling that have similar richness, but support the greater vocabulary of agent-based modeling. So here we might have an agent depicted for a given type of agent, say a person agent, compared to a healthcare worker agent, or compared to a companion animal agent. We have characteristics of that agent. We have processes governing their evolution. We have interventions indicated in social support networks, etc. So network context and spatial context. In all these cases, though, what we're often thinking about is what's endogenous, what's exogenous, and what's ignored in ways that we previously specified. Remember, exogenous means it's pre-specified to the model. We specify it. It doesn't mean it's always fixed. It's always constant. But if it's changing in a pre-specified way. It's not calculated by the model. Endogenous things are calculated by the model. It's running and it's generating those things, like the weight of people earlier, right? Okay, so why would you incorporate a variable in the model endogenously and exogenously? What might motivate you to incorporate it one way or the other in a model scope? Well, one reason for including it as endogenous would be if you suspect you can't adequately capture the key dynamic behaviors of interest, the key reference modes, the behaviors over time we see from the system, without capturing this. It's so central that we can't imagine capturing it without this variable present. So maybe we are interested in understanding the impact of tuberculosis on a community, and we can't imagine simulating that without capturing the fact that there are certain individuals who are latently infected with TB. Yes, Roberto.
When we have age, for example,
Yeah.
in that model that you showed
Yeah.
before, when the child is moving to adolescence, for example,
Yeah.
which generates a completely new system, new framework. So
Right.
how is that endogenous or exogenous?
It'll be if you want to be able to capture the dynamics from that in your model, if you think that is plausibly a very important component of what you're trying to explain, the dynamics that you're trying to take into account for your interventions, that could be something you capture endogenously within your model. The impacts of it. Now the question would be, would you specify the nature of that change for a child? The fact there's a change of behavior and entering adolescence. Would that be an emergent feature of your model or presupposed by your model? I would think in many health-oriented models that would be something that you would wish to specify to the model, that there is this transition point in adolescence, rather than trying to have the model generate that by virtue of representation of the physiology or something along those lines. There might be some cases where you're interested in, understanding body weight change and body composition, evolutionary dynamics, and where that transition hormonally and in terms of the metabolism is something you actually wish to sort of have within the model, generating some of the behavioral some of the consequences in terms of body weight that come from that. In which case you wouldn't purely specify to the model, above this age there's this composition of body weight. Rather, it would emerge from the model, from representing some of the underlying dynamics associated with metabolism. But in a lot of health models, that would be something that we specify to the model. Okay, is the nature of that transition. There might be more physiology-oriented models where you'd hope it could explain that or make sense of it or generate it. And Josh Epstein's comments that we don't truly understand a situation until we can generate it without presupposing it could be quite applicable there for physiologists trying to understand the nature of that. So one reason is we can't capture key dynamic behaviors without this thing. Without representing latent TB, we're not going to be able to understand its dynamics in a community or what have you. If we need to capture the effect of an intervention, ladies and gentlemen, this is very important. So suppose we're interested in understanding the effects of lifestyle interventions on type 2 diabetes or on heart disease. It will not be a plausible thing to start with a model which hard codes, which directly bakes into the model, which presupposes, the likelihood of becoming obese at different ages. That might be a perfectly legitimate description of the current situation, the current baseline, that at certain ages, a certain fraction of individuals are obese, right? Might be a fine description of the current situation, but we are interested in interventions that will bend that curve. And if we simply, in our model, impose an assumption at this age, this fraction is obese, how are we going to ask, well, if we had heavy investment in dietary change or heavy investment in physical activity programs, or we were to put in place, physical activity education for children through university or what have you, how would we, how would we expect to capture the benefits of that in our model if it's presupposed that at this age people have this distribution of obesity? Instead, we need to capture something about the dynamics of what's driving that obesity as affected by the intervention. There's going to be mediating variables associated with things like caloric expenditure, or associated with caloric intake, or associated with sedentary behavior and moderate vigorous physical activity that we need to capture as mediators for how the intervention is going to affect the outcome of interest that we care about. If we hard code the relationship of age and obesity, maybe an adequate description, we can run the model, will match today's data, but it won't be useful as a tool for investigating an intervention. So often this is one of the foremost things that we consider in our model. So if we're asking for that model we saw this morning, if we're asking what goes in here, why are there these things? Well, we want to understand how will placement of new supermarkets affect things. We need to know something about how is a supermarket going, the presence of a supermarket closer to home going to affect what they eat. And to represent that, we probably need something about a decision process about where to go that involves distance as well as preferences for types of food. We need to have some representation of food seeking, because we need people to seek food from a store based on their preferences and distance, based on that the outcome of that calculation for them to get food. That food has to somehow, if we're interested in how a placement of a supermarket and a food desert affects weight as an outcome, we need to represent something about weight and link it up to the food they eat. So we need something that links up, the fact that they are eating food to their weight trajectories, right? We need something that links up the fact that they're getting food from a convenience store or supermarket, the fact that they are subsisting in entirety on a bachelor's diet of screaming yellow zonkers. We need to understand how that ends up affecting their weight. And to do that, we might plausibly look at some of the dynamics associated with weight change in reflection of changes of energy in. Similarly, if we want to understand how park availability affects things, knowing something about how parks might affect their physical activity levels would be useful. And here, ladies and gentlemen, we have factors that are along the causal pathway from this change that we wish to put in place, the availability of a supermarket on the one hand, to weight. We need the elements of that causal pathway. That includes food-seeking behavior and involves the energy generated by that and how that affects weight. Okay? So rather than hard-coding, relationship between distance to supermarket and weight, it's actually easier to account for the dynamics within each person, sort of the underlying mechanics of the system, as it will. So here we have these factors representing endogenously because they are needed to get us where we need to go in terms of answering the questions at hand for how does placement of supermarkets end up affecting weight trajectories. So this capturing effects of interventions is a big motivator for placement of causal pathways. Another thing is, you may be interested in representing something because you're interested in how it would be affected by an intervention. So there may be a need to represent something to capture the effect of an intervention, because the intervention works through that causal pathway. But then there's another need of, if we add an intervention, how would it affect the thing of interest? Maybe you're interested in transfer effects, equity issues. You want to make sure that you aren't disadvantaging group A by an intervention compared to group B. So we're interested in recording certain outcomes to make sure that they're appropriate. We haven't implicitly transferred benefits from one intervention to another. So here, a concern about how something's associated with intervention outcome. Maybe we're interested in how an intervention further affects, not just obesity, but mean BMI, and in fact, affects, prediabetes levels, in which case we might need to represent something about that. Another motivation for representing something in a model, endogenously, is it's observable. We want to be able to compare the model against observables, and this is something pretty close to what we're representing anyway, so that we can compare it with observable data. We want to have the model produce that so we can cross-check the model. This is an opportunity to learn. If we discover a discrepancy between the model and what's observed from the real world, we've learned something. We've made a step forward. We failed forward. We've learned something we wouldn't otherwise have learned, that our mental model, our understanding of our best guess of what's going on is inconsistent, so now we can do better. And capturing these observables in the model is often a good way to do that. So often we'll make a little bit of additions to our models with what's represented endogenously, so that we can include output of observables. We can compare it against data sets that we have. Or we could collect this data fairly readily, so we capture it. Final thing, Jeff talks about this sometimes, is stakeholder credibility. Capture something in a model because stakeholders find it credible, they can relate to it, they can be inspired by it, it gives them confidence in the model. These things are sometimes the same sort of things that inspire scientific confidence. Sometimes they're different. Sometimes they're things that a policymaker might relate to just because it's something that they recognize that's coming out of the model. It's their neighborhood. It's their city. Or you have a physician, a physician, a poobah in a hospital. And they're not going to lend the model credibility unless they see it in terms that they understand. This is a challenge Jeff talks about, and I've seen bits of this with system dynamics models. Sometimes they're just too abstract for the stakeholders involved, for physicians involved. And the physicians like to see a model that's dealing in terms of patients and people. That's what they see day to day. That's how they think about the world, as individuals. And they see a stock and this kind of this aggregation, and they're not sure they can relate to it, but you depict people. Or you have a GIS environment that shows a familiar landscape, and people relate to it. We perhaps like to think of our policymakers as engaging in Solonic sort of level of contemplation of the policies. But the fact is we are dealing with a world where not all our policymakers are Solons, who make the most sage of decisions or engage in communicational behavior that's even remotely sane. Having something coming from the model that they can relate to, that speaks to them, is sometimes important. And sometimes we elaborate our models with visualizations that will help communicate things to those who lack the scientific background to understand what's going on, but it will help them understand what the model is doing, at least, what it's capturing at a high level perspective. So motivations for including things as endogenous, extra flexibility for capturing effects of interventions, greater robustness in the context of changes. If we represent things endogenously, ladies and gentlemen, rather than hard-coding relationships between neighborhood and obesity levels, we can often translate a model to different environments more readily because we've captured something more fundamental about the relationship between energy intake and weight, for example, that would apply in Melbourne and Sydney and Dubbo and small towns and big, etc. So we can translate it to other contexts. Now, greater endogeneity sometimes means more data. sometimes it means less data. This is a thing that's not awfully obvious, but I was just engaged in discussion over the weekend about an ongoing modeling project. A modeling project that I have evidence to believe is being advanced even as we speak by our stalwart TA Winchell somewhere out there in the hall. And I may be wrong, but I'm positing connections here. And ladies and gentlemen, this is a modeling project. We're actually capturing more things endogenous means less need for exhaustive data linking up observables. Linking up all pairs of these observables with that one, or interventions in that one. By capturing things endogenously, we have a more unifying theory that actually simplifies the model considerably and simplifies the amount of data that's required. It uses a common set of mechanisms rather than a tremendous number of kind of pairs of kind of mutual dependence. And it provides a kind of unifying theory that, again, can be translated. So rather than hard coding a lot of data into the model, we have a simpler underlying theory that can carry through many different variants of interventions. So endogeneity, building up endogenous components, is often very advantageous to a model, but needs to be balanced with the need for starting very simple. So I'd like to contrast this, because this if you go to the literature and you look at dynamic models, you will find a wide spectrum of where models fall here. And I will just note that a lot of, in the system dynamics space, in health, there's a fair number of models more towards the left side here with minimally endogenous. Not all. There are some that are more heavily endogenous, but there's a fair number that have fairly hard-coded statistical relationships for portions of them. In the agent-based space, microsimulation models are often more here. They deal with observables. They deal with the fact that income and risk of mortality have this statistical relationship between them. And use that kind of a bookkeeping exercise to sort of say, well, if we had this income dynamics, how would it ripple through to affect mortality rates? Here, the focus is on observables with these minimally endogenous models. The relationships between observables are hard-coded, and if there are disparities, like by ethnicity, you hard-code the fact that, we see this level of disparity in mortality rates for, African Americans compared with Caucasian Americans. The impacts of interventions here on the observables, like on the impact of this intervention on physical activity level or on obesity, more possibly, is hard-coded. It doesn't emerge from a series of causal pathways. And the interventions are generally represented as acting immediately. They actually play out more or less immediately. You have this statistical relationship, interventions in place, and we pause it, it changes like this, and we ask what the consequences are. The model here is really crafted to capture these statistical relationships which apply in the current context, as they apply right now, with a little bit of uncertainty to what degree will they apply in a counterfactual regime. And model is sort of a calculator or a bookkeeper in this context. It's taking into account a lot of different things, but in a kind of very routine, complicated but not complex way. It's sort of just keeping track of these different relationships and the number of people in these categories of that one. By contrast, heavily endogenous models focus predominantly on the causal pathways rather than observables. The observables emerge from the pathways, and the model often will incorporate quite a few latent variables along the way to the observables. But those common pathways will often be common to several observables. So, level of obesity and level of prediabetes and level of gestational diabetes and so on will be resulting from a common set of underlying dynamics involving metabolism and energy intake and expenditure, etc., rather than being things that each depend in some fixed way on intervention or what have you. The pathways here kind of give a unifying underlying picture for the dynamics, and the observables emerge from them. The interventions, the impact of the interventions or observables are mediated by pathways. And as a result, the impacts on those pathways is often causally and temporally distal. It occurs later. It's not occurring immediately, but it's occurring over time as the pathway plays out. In other words, as the adjustment to a new metabolic regime due to changes in physical activity level play out, the impact of the intervention starts to gain effect, rather than being sort of more statistically dependent on it. And disparities here are often captured by a minimal number of underlying parameters. An example for this is there's an interesting model by Sandro Galea, George Kaplan, that I was peripherally involved in helping provide input into and shape just a little bit. But basically they explained a lot of the patterns you see for disparities between African Americans and non-African Americans using essentially exposure based on the neighborhoods they lived in. They found a lot of the disparities health-wise could be explained once you captured the underlying pathways. Which was an encouraging result, rather than hard coding the fact that African Americans, have this level of physical activity expenditure compared to Caucasians. That was something that emerged from the environments in which they lived, etc. So the model captures here sort of a unifying underlying theory. So these are different points in the spectrum, and some dynamic models operate over here, some dynamic models operate over there. The dynamic models operate over here are often ones that depend very heavily on the current evidence and are designed to sort of take into account with that evidence being front and center, but they go less in terms of latent mechanisms. And endogenous models are often use evidence, but they use evidence by being compared against much of it. Rather than building it in. Okay, I think I'm going to stop on this front for this comparison. I have more contrasts for given topics, HIV spread or smoking, or contact patterns or environmental epi, zoonoses. I have comments about how these might be captured more endogenously or less endogenously that people might find interested. I also have some work here on pattern-oriented modeling, which is a thing you'll find in the literature. It's articulated most prominently by Volker Grimm in the pages of Science, perhaps a decade ago. And here the idea is that in our agent-based modeling, we're trying to characterize patterns we see in the world. I'm actually not that positively inclined towards it because I think it underplays the purpose of the model, but it is a useful read, and there's some thoughtful components of this. And fundamentally, one of the things is that focus on stylized facts that the model needs to match, the model needs to explain. We need the model, even though we don't have good data about it, it needs to capture these basic facts of the situation that we do know with high confidence. And often that allows you to sort of tighten up what the model uses as its representation. Yeah, Anton.
Sorry, what was the reference?
Volker Grimm, Grimm. No, Grimm's fairy tales. Volker Grimm, it was in Science, the magazine Science, and I think I actually have the reference in a sheet for you on the website, okay? But it's called pattern-oriented modeling, and if it's not there, I'll make sure that it is there soon. There's also a book that articulates it by Grimm and Railsback, RAILSBECK. And it's a, I've heard mixed opinions of the volume, but it's one of its other virtues is that it articulates the ODD protocol for describing models. Okay, but it also talks about this vision of pattern-oriented modeling. Okay, and I would recommend it as a reference book. It's focused around the platform NetLogo, which is a popular, simpler agent-based platform aimed at sort of people getting started with agent-based modeling, but has difficulty translating into industrial context, into larger scale industrial strength context, as Michael Wolfson puts it. Okay, great. I think I will I'll just mention a few things here. Ladies and gentlemen, when we're talking about building a model, we're often talking about a process of confidence building to make sure the model captures features of the situation we're interested in. For example, we may see temporal patterns. We have several models right now that are being developed. Pertussis, which Winchell will be presenting later in the week. Measles, chickenpox, childhood infectious diseases. And these models are designed to inform day-to-day decision-making by Alberta for intervention during outbreaks and to some degree to prevent outbreaks, prevention initiatives. So they're designed for operational use, which is very exciting for us. There's some components of this that we'll be seeing, but I should note that in this context, we are taking these models which are designed for current use, and pursuant to Kim's question, what if there's not enough data available, about things? One of the things we've done for these models is to take the model designed for today's use and translate the representation of the population to the population as it existed in historic period pre-vaccination, and see to what degree it explains the temporal patterns that are very well documented at that time in terms of dynamics of pertussis or dynamics of measles or mumps or chickenpox at those times. And there are very distinctive features. A lot more children were exposed to live cases of measles in the population. Same thing with chickenpox and pertussis. And we actually build confidence that the model has captured the patterns well by adapting it to that earlier context. And then, of course, we re-enable vaccination to translate it to a population in today's context with the added confidence that it's matching patterns in both eras very well. So, in other words, it's not simply that the model is contingent upon data about its current context. You could sometimes use it to address other contexts, and that's how well it carries over to those contexts and what it captures. After all, the technologies involved in measles vaccination are very different than the 1940s, to be sure, where the vaccine was not available. But the basic underlying natural history of infection for measles or for chickenpox is very similar to back then. And so we can gain confidence in the model by translating it back then. Ladies and gentlemen, I mentioned earlier that data and availability of data and ability to make use of data is a big motivator sometimes for what goes into a model. After all, if by extending a model in a certain modest way, you could tap into the ability to cross-check it with big volume of data, you've left a lot of money on the table unless you do that. Because you could really ground the model, have much greater confidence in it, much greater ability to learn from it, if you could compare it against more sources of evidence. And one of the areas that we do this with models is by capturing features of data that we see in the literature by small extensions to the model. So, for example, we might want to have a model where we can make use of data. This is for TB. And this is posit interval from latent TB infection to active TB. And it specifies for people exposed who got infected a certain number of years before they developed active TB, what's the cumulative percentage that have developed active TB? Of those who've gone to develop active TB in their lifetime, what's the cumulative percentage that do so within a certain period of time? And here, actually, so it's not within the lifetime, it's within these 9 years, what fraction would occur, within certain years. The point is that here we could actually compare, if we have a model that keeps track of the number of years since someone was infected as a feature of the model, then we could actually compare model results stratified by that against published data, for example. And this is a type of comparison which might only be made possible by adding in the ability for the model to clarify the distinction between, when they got infected and, in fact, when they have developed active TB. So we'll build in perhaps a feature of the model to calculate this. I would also note that this is something we did not secure with an aggregate model, a system dynamics model. Thanks, Jeff. That's tremendous. Thanks. So this was something we could not capture with an aggregate model very well, a system dynamics model. We really needed an agent-based model to capture this history of a particular person. How long for this person has it been between when they got infected and when TB arises? Ladies and gentlemen, one big feature of an individual-based model, agent-based model or discrete event model, is the ability to capture longitudinal progression of individuals. You can't do that well in an aggregate model. It's not feasible. People are numbers, the number of people currently susceptible, for example, and we can't readily break that down by how many times they've previously been infected. Or for those who are infected, how long was it since they were infected? We can't do that in an aggregate model. We do that in an individual-based model. And one of the motivations for using an individual-based model is to open up opportunity to compare the model results against empirical data like this. By capturing things at an individual level, it opens up the ability to take into account network data, to take into account data involving individual histories, to take into account heterogeneity of the population. These are things that we could keep track of in an individual-based model, which are not possible for us to take into account and to compare for an aggregate model. Okay, so this choice, aggregate, individual-based, one of the motivations for me as a practitioner is I'm a skeptical modeler. I carry a gimlet eye for the models that we build. I worry that we place undue confidence in them, and I'm always looking for ways to challenge them, to cross-check them, to falsify them in Popperian language. And one of the motivations for agent-based models is they allow us recourse to comparison against a much larger variety of data. Longitudinal data, network data, spatial data, data concerning very heterogeneous populations. Those things can be captured in an individual-based model in a way that is not easily possible with an aggregate model. So model architecture has a big impact on to what types of data you enjoy recourse. You want to make use of the network data, like this TB graph? We're not going to be able to make good use of it with an aggregate system dynamics model. We need a model that's at least an agent-based model, maybe a hybrid model. Same thing with spread of these patterns noted by Christakis and Fowler from the Framingham study with spread of obesity in a network. We can only compare our model results against this, our emergent model results against this to cross-check consistency if the model can represent networks. Networks spread over in space, such as for SDIs. We can do it if we represent space and networks, spatial effects, distribution among individuals in the population. This was some work by my colleague Asad Al-Azam, which we subsequently extended by student Yuan Tian. Has done some very nice work advancing this in big ways, but looking at how a network position ends up affecting risk to an individual. If we have a model that has networks in it, where we're simulating the infection of individuals and progression to active TB for individuals over time in their network context, we can compare the results of that model against the network degree and compare it with empirical data. So a big motivation for why we incorporate things like networks in there, or why we use individual-based models, is we can make use of additional data to cross-check this model. So I think that's those are most of the features. I guess I should mention, and this is with a nod to my physics colleagues. Physicists, ladies and gentlemen, have for millennia worked to characterize the way the world works. Much of physics is characterizing processes in the world. Within physics, there's been a coming to peace with some of the issues that the health domain is just struggling with models. And one of the things is that physicists long ago realized that when it comes to developing confidence in a model, comparing it to real world data, there's many dimensions of that. It's not merely point-wise comparison against specific data points. Sometimes you look for features coming out of the model that are general patterns that you see, and the exact timing of them, the exact details, are not to be so much relied on as the general features and perhaps their periodicity or what have you. So oscillations, gradients that we see, waves over time, phase change phenomena, what have you. Physicists have long recognized these as kind of features of a situation they want to capture with a model. So it's not purely always reducible to nice data like this, or to data, curves here, log linear curves involving frequency of number of sexual partners here, and the number of people with that level of contact there, or this sort of data. Often, ladies and gentlemen, what we're trying to match against is, or in some cases, we're trying to match against qualitative features of the situation. Women, are subject to a higher prevalence of gonorrhea than men, or individuals who are with a certain background have rates far higher than those with other backgrounds. Those may be features we're trying to capture at a high level. So data, evidence, ladies and gentlemen, the need to understand how that evidence is going to be changing for interventions. These are big motivations for capturing things within the model. We select the model architecture, agent-based, individual level, on the one hand, and aggregate on the other, often based on the need to want to be able to compare against data, the ability to capture certain data from the model and compare it so we can build confidence in the model. Interventions in their linkage to outcomes will often incorporate latent factors that mediate that, because they provide a more unifying theory and because they allow us to capture the effects over time of that linkage. I think I'll stop there with those comments. Jeff, is there food out there? Okay. Okay. There is food out there. And then there are hills. So I guess we'll break a little bit for is this afternoon tea? Okay, so is that designated as 20 minutes? Okay, 20 minutes. So I'd be glad to take questions one-on-one, or I can also answer them after you come back. Very good. Thank you very much for your attention. So, Jeff, might it be possible